Good afternoon, everyone, and welcome to Tallahassee Memorial HealthCare's unfortunately continuing series on the state of COVID-19. This is a panel discussion and a Q&A today. We thank you for joining us. We are sorry we need to be here, but personally, I'm pleased that we have an organization like TMH in our community to help answer these questions. My name is Skip Foster. I'll be your moderator today, and we've got, as usual, fantastic panel. I want to introduce them now. We've got Dr. Dean Watson, who is the VP and Chief Integration Officer at TMH and Capital Health Plan. Dr. Thomas Truman, who is a pediatric critical care physician at TMH's Children's Center. Dr. Susanna Zorn, family medicine physician at TMH's Urgent Care Center located in Southwood, and Dr. John Streacker, who is the medical director of TMH's Urgent Care Centers. Thanks to all of you for joining us today and lending your expertise to the community that still has a lot of questions about this pandemic, the new variants, and what things look like going forward. Some of them have submitted questions ahead of time. We're going to be diving into those and some that we've already formulated here based on feedback that we've gotten from folks. If you have additional questions and you're on the webinar right now, please use the Q&A feature to submit them. I'll be looking at those as they come through and sharing them with our experts in real time. So let's get started. And we're going to start with you, Dr. Watson. Give us paint us a picture of the state of COVID at TMH right now. What are you seeing? How's it different from how the pandemic has evolved over the last, almost 2 years now, and just current state?
Sure. Thanks, Skip. So currently within the walls of TMH, there are 67 COVID patients. Of those, 52% are related to COVID specifically, 48% are considered incidental, meaning that they were incidentally diagnosed with COVID through testing. They're not being impacted by the virus. That's not the reason that they're here. Now, of the total number, 36 are vaccinated, 31 are unvaccinated. Mostly the individuals that are being impacted the most through critical illness or through severity are unvaccinated still. So this virus has impacted us a little less than Delta. Delta was quite an impact on our system and on the community, and so this one's a little less. Tom, I think you guys, if you guys can mute your, I think we're getting echo across the. Thank you guys, Streak Master, thank you. So the impact is a little bit less related to severity, a little less pulmonary involvement, a little less of the intensive care type cases. Although this virus is more transmissible, it still appears like it's going to be a little less virulent, which is really good news.
Yeah, on this, thank you, Dr. Watson. And just to follow up on this incidental, those aren't people that catch COVID at the hospital, right? Those are people that didn't know they had COVID, came in for a broken leg, and as a part of the testing or whatever, they're discovered to have COVID. Am I getting that right?
Yeah. The majority of these folks are individuals that we capture basically on pre-testing for procedures or testing because of concern for risk of exposure or for transfer to skilled nursing facilities. That's the majority of those cases. That's correct.
Great, thank you. Dr. Truman, what about the pediatric side? Now that's your specialty. How is that different from grown-ups, right? Okay, so you just went on mute there. There you go. Come back the other side.
Can you
there
hear
you
me?
go.
Okay, sorry. Yeah, with the Omicron variant, yeah, we've definitely seen an uptick in the pediatric admissions, and similar to the adults, we're seeing probably at least 60 or 70% of the admissions that are COVID positive are incidental. They're here for other reasons, infections or that aren't related to COVID. But then when we test all the patients that are admitted to the pediatric floor, some of them are coming back positive. But we're definitely seeing an increase in the number of admissions. We've had right at 19, 20 admissions with COVID positive kids this calendar year. So in the last 14 days, we've had just under 20 admissions. And so, yeah, we're seeing them. None of them have been critically ill. Some of them have been in the intensive care unit, but not because of COVID, for whatever other reason they were here for.
Okay, great. Thank you. And I want to turn to Dr. Zorn, and the challenges of Zoom technology are its own pandemic, right? Follow us around. But what about in your space, the kind of outpatient space? What are you seeing? And I'm particularly interested in how it's different from the other stages of the pandemic.
Would you like me to speak to that?
Go ahead, Dr. Streacker.
So early on in the initial stages of the pandemic, we were seeing that there was a reluctance to come to the urgent care, the emergency room initially. The patients were much sicker. The symptoms seemed more mild initially. And then around day 5 or so, the patients would either get better or they would get a lot more sick. What we are seeing now are patients that have a little different symptom complex. They seem to have more mild symptoms, and that's essentially what we're seeing now. So those that tend to be vaccinated and boosted, their symptoms seem to be a lot more mild, more like bad cold symptoms. However, those unvaccinated tend to have markedly worse symptoms, more like the flu. That being said, all tend to improve within about a 5-day window is what I'm seeing.
And Dr. Streacker, while I've got you, and I apologize, we're having some technical problems with Dr. Zorn, so we're going to be leaning on you. When we talk about, and maybe Dr. Watson, after you can chime in on this, when we talk about vaccinated people, how are we defining that? Is that 2 shots, 3 shots, more shots? And how much difference is there between 2 and 3 when it comes to the type of symptoms that you're seeing and those kind of things?
Well, definitely with the Delta virus, those that were vaccinated had much less symptoms. I would say that vaccinated, I would call either the 2 shots of Moderna, the 2-dose vaccination of Pfizer, or the single Johnson & Johnson. Boosted, those patients, we're seeing those just now because the boosting just is a more recent thing. I'm not sure what else, the other question.
I think I'll answer a little bit of that. That's to your point, Skip and John, is that the folks that have been vaccinated with 2 shots and received a booster are doing quite well. When we look at that population, we know for a fact that the antibody production for these folks remains elevated at minimum at least in 6 to 8 weeks after the booster. And you say, well, that's not very long. Well, that's true, but we do know that after they're boosted, 6 to 8 weeks, their protection is excellent. As it starts to wane, the protection is still very, very good, and it still protects against severe disease and hospitalization. And that's what Dr. Streacker is talking about. When you look at these folks that have been boosted, they're doing really well. They come in with minimal symptoms. We know they're going to have some symptoms, but really up to that, after that first 8 weeks, yeah, they may get a little something, but overall, they're still protected. With 2 shots and no booster, you still have protection against severe disease and hospitalization, but your chances of having those mild, moderate symptoms are increased. So the bottom line is with vaccines in consideration is 2 shots, yep, consider vaccinated, but we know that your symptoms may be a little bit worse after just 2 shots and no booster, just because of those antibody levels. That's clear. But again, I just want to hammer this home. The protection is in the severe disease and hospitalization. And it still holds true today with Omicron. We're still seeing the same things we saw with Delta. People that have been vaccinated and boosted, doing great. People that have been vaccinated without a booster, doing very, very well. People that have not been vaccinated, they're in the category or don't have natural immunity. I want to include that in there. Don't have natural immunity or have not been vaccinated, then they're not doing as well.
So while I've got you on that topic, we've now got this large percentage of people who have had Omicron, that variant, larger than any other of either the Delta or we'll just call it Alpha. What is their now next step when it comes to shots? What should this big group of people be kind of have in their mind about what comes next for them?
Meaning that these are unvaccinated, then infected. Is that what you're asking me? Yeah.
Well,
so
anyone. So whether I've had 0, 2, or 3 shots, now I've gotten Omicron in the last month, right?
Yeah.
Or that's basically when we've had it. What's my next step going to be when it comes to vaccination?
Right. So great question, because if you look at the studies that are coming out, and remember we've only been doing this for 2 years. You look at the studies, most recent studies for those individuals that have been vaccinated, whether it be 2 shots or booster, and then subsequently infected, they fall into a class where we call them super immune. It's not really, it's just something that we assign them, but that's the best class to be in. If I could be vaccinated and had a mild infection, now I've got natural immunity and vaccine induced immunity. This is you're perfect. You're going to do very, very well. In a population that had Omicron and is recently infected, that there's clear evidence out there from the Delta group that folks that get vaccinated, at least within that 90-day window after infection or beyond really, but really that 90-day window according to CDC is they do better with vaccination and natural immunity. It's that combination, natural immunity, vaccine-induced immunity, is that super immune population. Now, people could argue that with the evolution of this virus and people that have been infected recently, do I need to get vaccinated in the future? Those studies are continuing on, but I can only point you back to the studies done with the Delta variant showing that, yes, you do better once infected and then vaccinated. Post, you do better. But natural immunity folks do very well, post-infection too. So this is why people need to sit back, look at the data over the next 90 days, and let's see where Omicron's going, and let's see what the next variant has to bring.
I'm going to go to you next, Dr. Truman, but I want to ask one more question of Dr. Watson on this. So I know there's somebody listening, maybe more than one person, that says, oh, well, if that's the case, why don't I just let her rip and catch Omicron? I know it's not severe. That people that would have never said this for Delta, that was just obviously a much different thing, and become super immune. I've had my shots. I'm not averse to getting shots, but I'm also not really interested in being masked for the rest of my life when I can basically catch a cold and be immune from the next, or you understand what I'm saying? What's your response to those people? Why is that flawed logic?
Right. So I would just caution the thought process just a tiny bit in this. One, it's a nice moment in time where we can say, hey, I'm not scared to death if I get COVID because it's Omicron. Well, that's a nice place to be, but I would warn everybody that yes, it is less virulent than Delta, but people are still getting very, very sick from it, and people are still dying. That's the part we kind of miss. And I would also say that prevention is better than I would rather prevent it and make the symptoms milder than go and try to infect myself with something that I have no control over. So most people are going to do well? Yes, but I cannot guarantee that if you say, well, I'm going to walk out and I want to get infected by this thing so I can just get it over with. I would remind people to go back and look at history. Go back and look at the individuals that actually did this with Delta, and many of them died. So they felt, I'm going to inoculate myself with a large amount of, or high amount of this virus, and they did not do well. So yes, I am less concerned about myself getting Omicron. Yes, I think you're going to do very well. Is prevention better, vaccination? Yes. Just in case you do get it, because then the symptoms are much milder, and then you fall into that super immune category. I would just caution folks on that thought. But again, last thing I'll say is the good news is that we're having these conversations where we're saying, hey, this is kind of evolving into something more like the flu. That's what we want to see. Those are the conversations we want to be having the next time we get together to say, hey, should we really be testing? You know, because now this is more like the flu or more like the cold. Let's all hope and pray that's where we are 3 months from now.
So Dr. Truman, on that point, if I'm a parent and call you up and I have an exposed 8-year-old that is asymptomatic, should I be testing that child or not? Uh-oh, still on mute, Dr. Truman. And trust me, it will happen again, so it's okay.
Trying to avoid the feedback here.
It's all right, I don't blame you.
Okay. Yeah, that's a big debatable question. Testing right now, I think it's important to know that if you have a good exposure right now, I think it's safest to test just to prevent passing it along to other people if you continue to have the child in school or visit family members, especially family members at high risk. But certainly anybody that's symptomatic, you know, the recommendations are similar to the flu, is, you know, supportive care, stay hydrated, and avoid contact that's unnecessary to reduce the likelihood of spreading it. Nope.
See, I did it. Can you just give us a 20-second, here's where we are with what the CD is recommending for vaccines by age group with children, just so people know or reminded of where we are on that.
Sure. Right now, the CDC recommendations are for ages 5 and up, recommend that all children 5 and up get vaccinated. Ages 12 and up should get vaccinated, and recommend that they get the booster. The booster is not yet recommended for the age 5 up to 12. And so under age 5, it's still not recommended, but that's where we are with the current recommendations.
Great. So Dr. Streacker, I want to come back to the discussion we were just having because some viewer questions are coming in. And one of those is, hey, I was vaccinated and boosted. I still got Omicron. Does that mean I'm going to be vulnerable the rest of my life despite being vaccinated? I mean, am I just, you know, or how do I know whether I'm super immune or actually kind of chronically vulnerable?
First and foremost, I think having vaccination and boost is going to be the most protective. Once you have had Omicron virus, yeah, sure, you do get a little extra protection there, but we don't know what the next virus will bring. You know, different mutations can bring a different symptom complex. So always continuing to have the appropriate measures of being boosted, vaccinated, boosted, and then being very careful, wash your hands, do the things that we've been doing. That's how you're going to get the most protection. But I would never rest on my laurels and think that I'm just super protected without doing all of the due diligence and vaccination.
And Skip, just real quick, back to the viewer's question. That doesn't mean that they are vulnerable, right? We know the transmissibility of this specific virus is penetrating through you know, all of the things that we have to protect ourselves, so that they're human. And in the future, and if they're doing well, that just shows you that the vaccine worked and that their immune system worked. And to John's point, in the future, with new variants, who knows, their body will remember Omicron and it will remember the vaccine-induced immunity. And we'll have more conversations in the future about the next variant. You know, are they protected? The ultimate goal is to get to, you know what, like the flu shot a year, then we're good to go. That's the ultimate goal.
And again, these are great questions we're getting trying to get a point put on this, and the answer may be, well, we don't know yet, or we can't put a point on it. So feel free to respond that way. But another question is, okay, I'm vaccinated, I'm boosted, I've had my third shot. What's next? When are the fourth and fifth shots, or are those going to be recommended? So what's the course of action for someone who was recently boosted?
Yeah, I don't want to take all the airtime because you got so much better looking people than me on this, but that's a question that we can't answer yet. You see that Pfizer is working on the Omicron vaccine now. Well, that's great, but by the time that's done, it's going to be the next variant. Again, the opportunity, the wish, the prayer is that this thing continues to evolve into a even less virulent strain where it will be a once-a-year vaccine that all of these companies will have available. So that's really a next 30, 60, 90-day question for everybody, for all the panel, I would think, unless someone disagrees.
No, totally agree.
Great. So before I leave you, Dr. Watson, we're hearing about new variants, IHU, even this Deltacron thing. How much validity is that? How prevalent are they? And kind of what's coming down the road?
Sure. So the IHU recognized in France, and it's actually been recognized for longer than a year. And then the infamous Deltacron, which was University of Cyprus, which people are feeling it was actually a contaminant in the system. Again, these are, and I just want to remind everybody that this is how viruses work. Viruses mutate to survive. And this virus is going to continue to mutate. It's a coronavirus, just like a cold virus. It's going to continue to mutate. So we're going to see more and more and more variants. We're just so focused on COVID, as we should be. That's why you're hearing about more and more variants. If we were focused on the cold like this, we'd be hearing about all types of cold variants. So again, the ultimate goal here is to see this thing mutate to a point of minimal impact. And I think it's way too early to talk about IHU. I think Deltacron may or may not be real. We'll see. They're investigating right now. So again, let's watch over the next 90 days. Everyone appears to be doing what we need to be doing, and I wouldn't change that.
But right now, you don't see a variant on the horizon that causes you concern or anything like that?
Well, I'm cautious to answer that because I think maybe Truman and I were on the last call, and we warned that this would be that we would be here in December and in January. But I would say I'd like to focus on the positive and say, boy, it looks like Omicron has mutated to the point where it's less impactful, still impactful, folks, less impactful. And I hope the next variant, because there will be another variant, I hope it's even less impactful and we won't be talking about it like we're talking about this. So nothing that we see right now, but I'm telling you, we'll get off this call and then there'll be something posted about a new variant, and but not at this moment.
Okay. Dr. Zorn, can you hear me? It looks like you have stabilized your connection, and I know that's frustrating to have those things happen. So I'm glad you're with us. I'll ease you in with a nice, easy one to start. What's the exact date we will find a cure for COVID? No, I'm kidding. I want to ask you about, we got a lot of folks that have it right now that are probably watching from their house. We know the numbers are high. If you've got it at home, what's the best just course of action, course of treatment at home? And if you've got people at home that have it and some that don't, how should they be living within the home?
So for people who already have it and are watching right now, I think managing symptoms as best as possible. I generally tend to recommend for any congestion, Mucinex, nasal saline rinses. Make sure you're taking a multivitamin to help your immune system. And then for anyone who is at home, who may be sick with them, or they're just waiting, counting down the time, hours before they become infected. For the person who is infected, making sure they're wearing a mask. If they can, sleep in separate rooms, hand hygiene, that sort of thing. I think the good news overall, though, is we are seeing more mild infections. And if you are vaccinated, they're even more mild than people who are unvaccinated.
So if I'm one of the unlucky few that it isn't mild, what should trigger a trip to the hospital for me? What are the things that I should look for that would cause me to say, hey, I can't handle this at home anymore?
So the same things that we were looking at in the beginning of the virus are the Alpha variant and then the Delta variant, trouble breathing, chest pain, fast heart rate, confusion, new confusion, inability to stay awake. Those should all prompt medical evaluation.
Okay, good. That's helpful. And Dr. Truman, I know this back to school thing is obviously a point of concern and stress for a lot of parents. You know, what would be your advice to parents for keeping their kids safe at school? And then kind of almost not really related to that, but there are a lot of all the other illnesses didn't get on a cruise ship and leave town just because we have a pandemic, right? So are you seeing other illnesses prevalent that are not COVID, but could be mistaken as such? And how do you kind of figure out how to, you know, treat those things in a COVID world?
Sure. Yes, it is the season. We're in the middle of our usual viral season for children and infants. And so we are seeing those usual numbers and the other viruses, RSV, influenza, a host of other ones. We're seeing those this year, but then we're also seeing the COVID. And that's why it's been such newsworthy is of the sheer number, or we hear some hospitals that are overrun, children's hospitals that are at capacity. And most of those are in the Midwest because they're dealing with all the usual viral illnesses that we deal with every year. Plus they've got their Delta surge is later than ours was back in August, and they've got the Omicron on top of that. So, but in order to deal with going back to school, it's the same as usual. Good hand hygiene, recommend still wearing the mask, and obviously back, you know, if thinking about getting vaccinated, absolutely the recommendation, not only from the CDC, but the American Academy of Pediatrics and all the pediatricians here in Leon County, all ascribe and all highly recommend getting the vaccination.
Great, thank you. Dr. Streacker, I usually paraphrase these questions, but this one is, you can tell, well thought out. I'm just gonna, and it's a little long, but I'm gonna read it to you because I think it's a heartfelt question. And the viewer says, when we talk about COVID becoming more like the flu as time goes on, what will be the recommendations for those who are immunocompromised / unable to get vaccinated? And this person writes, I think my fear is that the virus will become like the flu for the vaccinated, but will still be just as dangerous for people unable. And this person says unable being the key word, not unwilling to get vaccinated. So how would you respond? I think that's a really good question. What would you say to that person?
I would say always continue to do your due diligence by proper hand hygiene, you know, wear masks in public, follow close guidance with your providers that you have, staying healthy, having, you know, trying to have the best ideal weight, continue to exercise, get good sleep, have a good diet, stay well hydrated. But at the end of the day, yeah, you have to do all these other measures to just continue to, you know, stay protected, given that you don't have the opportunity for that. There are other things, however, if they do get sick, they can see their healthcare professional, and if necessary, they can get monoclonal antibody treatments, which are available in Leon County.
Well, so I'm glad you brought that up. That was going to be my next question is what are the availability of some of the monoclonal antibodies and some of the other recently approved treatments in Leon County, and for whom do you recommend those? Because from prior webinars, that was, for folks that really that was a Delta thing if you were going to get it bad. So what qualifies for that, and what's available?
You want me to take that, or you want to take that, Streacker? Yeah. So let me even add on to what Dr. Streacker just said to that question, and that is that the ultimate goal, the ultimate wish is this virus will evolve so that even if you're not vaccinated, it would still function like a mild flu. So that there's less. I don't want anybody to be stressed out there thinking, oh my goodness, if I can't get vaccinated and this thing mutates to a less virulent strain, I'm still going to die. No, we're hoping this thing evolves so that even you all will be less impacted. To the treatment side, I just want to caution everybody that the rollout of the monoclonal antibodies to the state of Florida has been very, 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 very slow and limited. And so there are numerous monoclonal antibodies. Those are the treatments, if you will, that provide your body with antibodies to attack the virus without your body producing them. They're synthetic. The problem is that every time this virus mutates, the monoclonal antibodies become ineffective. And we knew this. Last time we talked about this. So it's come true. So this variant, Omicron variant, is resistant to all of the other monoclonal antibodies that have been used against Delta. They don't work, except for two. One is sotrovimab, which was ruled out into the state of Florida, and we only get a couple thousand doses to the state of Florida per week. Leon County TMH has received none, and we have limited supplies, if any, in Leon County. So when people go rushing out to get monoclonal antibodies, they're really not overly available yet. They will be coming. But the good news, again, remember, it's not as severe as disease as Delta. The other one is called Evusheld, and Evusheld is protective. It is a monoclonal antibody infusion that allows your body to be protected for up to 6 months, over 80% protection against severe disease. Now, the focus for that is to be used in folks that are on chemotherapy, that are significantly immunocompromised, to prevent them from getting sicker. Sotrovimab, the monoclonal antibody that is used just like the other ones were used, is more for people that are obese, diabetic, COPD, or lung disease, is immunocompromised. But that happens, we use that drug in patients that are already infected. So Evusheld we use to prevent, sotrovimab we use to treat. And again, both are limited. We just filled out our forms, our computer forms this week to get Evusheld if we can get any supply at all, so that we don't have that one either. So those are really the two main treatments that are available in the state, but in limited supply.
There was a pill too that was being developed. What's the status of that, and what's its availability?
Two pills available. Both Pfizer and Merck have pills, antiviral pills. Clearly, Merck's is a 30% reduction in disease, and Pfizer's is above 80%, and they're also available. Pfizer's is available in limited supply. Merck, I haven't seen theirs out yet, but I'm sure if Pfizer's out, Merck's is out in the local pharmacies. But again, very limited. And I just want to remind everybody again, because when people hear this, they say, "Oh, I tested positive. I got to call my doc for sotrovimab, Evusheld." Well, they wouldn't get Evusheld, but sotrovimab and or oral antivirals. They're really specifically used for people that are very high risk, right?
Okay.
The majority of people are going to do great. It's the people that have severe, obesity, immunocompromised. I'm on chemotherapy. I've got cancer. You're who we're talking about.
Great, thank you. Hey, Dr. Zorn, back when I had COVID, which was a long time ago, it seems like a really long time ago, there was people were pushing zinc and vitamin C and all of these kind of, vitamins and various combinations of over-the-counter things. Is that still something that people should be doing if they're sick or to prevent getting sick?
So I think that I don't think it needs to be something excessive, but I do tend to recommend the TMH COVID handout, which I think lists several supplements like vitamin B, C, D, zinc, pretty much everything, like things that you should be taking on a regular basis anyway. So I tend to just recommend someone take a multivitamin if they're not already, and then, encourage them to eat a healthy diet, make sure they're staying hydrated, continuing to exercise and sleep. That's the best thing that's going to help your immune system, is to just make sure you're supporting it in every way that you can. So yeah.
Great. And Dr. Streacker, what's the latest on when I consider myself to no longer have COVID after I had it, right? How long after symptoms? Give us the latest on that.
Okay, so the CDC recommends currently that if you're infected with corona, you isolate for 5 days, provided your symptoms are improving and you've been fever-free for greater than 24 hours without having to take antipyretic or medications that would reduce your fever, then it's recommended that you continue to wear a mask for the next 10 days. At that point, however, you can still test positive for the coronavirus via PCR, but it doesn't necessarily mean that virus has the same ability to infect others.
By the way, is the testing for Omicron as reliable as it has been? It seems like there's a lot of folks that, yeah, I was sick for 3 days, I got negatives, and the next thing you know, I got a positive. Is Omicron more evasive to our tests?
I've not been seeing, on the ground in my clinic, I've been seeing it just as, the test has been just as accurate, our PCR test that we're using, so.
Hey, John, just clarify.
Dr. Watson.
Yeah, just to that point, Dr. Streacker has a lot of PCR support, and the PCRs are as accurate. PCR with the TMH and FSU lab, local lab, perfect. And that's the support for Dr. Zorn and Dr. Streacker. The antigen tests across the board are not as accurate. And quite honestly, as we've told you guys in the past, the antigen tests are not great tests across the board for COVID in general, specifically, and more importantly, for people that do not have significant symptoms. So we always caution people, and I know Dr. Streacker does, and I know Dr. Zorn does, if they're going to test with an antigen and it comes back negative, they always will send a PCR because they want to confirm it. And that's the same truth across all of the TMH practices. If we're going to use an antigen test because of an early screen, then we're going to send a PCR for confirmation. Antigen tests, I just want to say this so that everybody understands, just because you have a negative antigen test does not mean you do not have COVID. I want that to be very clear. And we've talked about this numerous times. If it's positive, the likelihood of you having COVID is very high. You likely have COVID. If it's negative, that doesn't mean you don't have COVID.
And is the same day PCR test that I believe a private provider is offering, is that as reliable? And these saliva, there's also the saliva PCRs. Is there a difference in the reliability of those?
Higher reliability. Anytime you go to a PCR, it's higher reliability. If it's rapid PCR, they're about the 90% range. Our system is, and people will argue this, by the way, I'm going to get hate mail for this, but it's the truth. I'm sorry. And the TMH FSU lab it's 99+%. I mean, it's fantastic.
And what about, so if you've got, okay, people come to the hospital for something other than COVID, they are determined to have COVID, they were asymptomatic, they didn't know it. So you would extrapolate that to say there's all the people that don't have a reason to go to the hospital, that there's plenty of asymptomatic COVID people out there, right? They just don't know it. Is there, what is the antibody test value now? Is that something that people should be looking at to after this wave where there were apparently a fair number of asymptomatic people. What do you all think of that? Go ahead, Dr. Watson. Dr. Truman, you look like you want to get in. Go
Truman.
ahead.
No, I was only going to say, fire away, Dean.
Yeah. So it was beneficial during Delta for us to see who those asymptomatic positives were, especially when Delta was the predominant strain, because we would have less concern about them being actively infecting others if we can, once we got those antibody results back. Right now, it confuses the picture because the answers we need are what one of the previous questions were from one of the viewers. How long does my immunity last and what does it mean? If we know that the immunity lasts and it's going to be effective for an extended period of time, these antibody tests are great. We can determine if someone is going to be less vulnerable over time. So they are helpful there. The other place they're helpful for us in testing is we have the ability to break the antibody test down to determine if is this a real infection or is there, is there immunity secondary to vaccine, or is there immunity secondary to virus? We can do that by looking at specific antigens that we study. So that does help us in the hospital, but for the general population, it's a great question because we've got to see how well, and I think it will. I just want everybody to hear some positivity. I think that the immunity that we're generating through Omicron is going to be very beneficial for a short term in the future. I think it is.
So I didn't do a good enough job asking this question. I'm finding from readers who are asking for more clarity. And so I just want to ask it very straightforwardly. And if the answer is we don't know yet, stay tuned, then that's great. If I've had Omicron, what is my next step when it comes to a booster or getting further vaccinated?
But we have to ask a question of the question. If you were vaccinated prior and you had Omicron, you are good to go. If you
good to go means I don't need to get another shot until some research indicates otherwise.
You're good to go right now.
Okay.
Until we have further studies over the next 90, 120 days. If you were unvaccinated and you got Omicron, and that's where the population I was speaking of, then I would tell you this: the studies with Delta are clear that those that were infected and then got vaccinated had a better immune response than those that just got infected. Now, this is a personal choice, okay? If you have natural immunity and you feel, hey, I feel pretty good about my natural immunity and I'm gonna watch it over the next 120 days, because you know over the next 90 days, you're rock solid. You know that your immune system is gonna be firing. We know that for a fact. Then you can watch to see what happens, because if Omicron's immunity holds true and it allows us to have some defense mechanisms for an extended period of time, then you could wait and go on that yearly vaccine regimen. That's fine. All I can tell you, I can't tell you what to do. I can tell you what the studies show. The studies show if you've been unvaccinated and infected, your antibody response is higher if you get that extra vaccine. Does that mean that you're going to do better? Probably, but that's a personal choice. Are you protected for the next 90 days, unvaccinated, infected? Yes, you are, and probably longer than that.
And for the purposes of that excellent summary, are you defining unvaccinated as less than 3 shots or no shots?
I'm saying no shots.
Okay, great. So Dr. Zorn, in Leon County, the Omicron wave has not yet peaked, A. B, is peaking, or C, has already peaked?
I think it's supposed to peak this weekend and then start to come back down.
So we'll say
that.
B is peaking.
Yeah.
Everybody agree that that's close enough? Why is that so funny?
If you're picking on Dr. Zorn, that's just
No, I'm not. Yeah, so you got technical problems around here, you get all the hard questions. No, I'm not picking on her at all. I made it a multiple choice question. Come on, that's what we all want. So thank you for that, Dr. Zorn. And Dr. Truman, we talked about kind of the remedies at home for adults. Are they any different for children, or is it pretty much the same course?
Pretty much the same course. It's supportive care, fever control, staying hydrated. Those are the most important things. Multivitamins, fine, but things like that you hear on the news about ivermectin or high doses, super high doses of a specific vitamin, none of that is recommended in children.
This is for any of y'all. Is the problem with capacity right now more about the number of patients or more about the number of staff that you have to take care of the patients, or neither, or both?
I'll start with that because that's part of my job. So what we're seeing right now is a major impact on staffing, not only in hospitals, but also in facilities around the community. And when facilities, I mean skilled nursing facilities, rehab facilities. If you're impacted there, that's part of our flow, right? We get people in the hospital, get them to rehab. Well, if they don't have staff, that delays our discharges. But all of the above, it's impacting us from the staffing point where we don't have enough staff to do some of the things we need to be done, but we're making it work. Please, just want to caution everybody, there's still high quality care being delivered. And then the infections themselves, these 67 patients do consume quite a bit of resources, and they're an elevated care for those 52% that are here for COVID. The care elevates. For the other 48%, the use of PPE, the isolation, things like that, it's a higher level of care. So they all play in together. But to Dr. Zorn's point, we hope to see this to start trend down over the next 2 to 3 weeks so we can get back to our new normal.
Okay, gang, we're at about 50 minutes. Is there like some big point that you were dying to make that I didn't ask you about? No, I know you guys. You're like, can I please go back to helping people? And well, look, you've helped a lot of people today. Very much appreciate your contributions, and I know behind you are countless other doctors and nurses and technicians and staff that have sacrificed a lot. So to Doctors Watson, Truman, Zorn, and Streacker, thank you very much for your time. Thank you to TMH for providing this forum. And I hope everybody stays safe and has a great weekend. And I hope we don't have to have another one of these again, right? Wouldn't that be great? So be safe out there. Thank you for your time. And of course, you can refer folks to the recording this so that it'll be available later if they want to catch up. Thank you. Have a great afternoon.
Right. Thank you.